Over the last several decades, the number of people living with multiple sclerosis in the U.S. has more than doubled. Nearly 1 million Americans are living with the condition, and about 200 new cases of MS are diagnosed each week. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about the importance of early detection and exciting new advances in treatment. With me today is Dr. Rola Mahmoud. She's the director of St. Luke's Comprehensive Multiple Sclerosis Center and one of only a few fellowship-trained MS specialists in the region. Thank you so much for joining us today.
My pleasure. Thank you for having me.
So first, Dr. Mahmoud, what is multiple sclerosis?
Multiple sclerosis is an autoimmune disease that affects different parts of our central nervous system. And our central nervous system is our brain, spinal cord, and our optic nerves. And so what happens in MS is that our immune system that normally fights infections and cancers starts attacking our central nervous system. And it specifically targets the myelin sheath that coats nerve fibers. And so when people start having attacks to these areas, they start presenting with stroke-like symptoms. They usually develop symptoms that last for more than a day and may evolve over a couple of days. People present with anything from weakness, tingling, numbness of the face, arm, and legs, vision changes such as double vision or blurry vision or even vision loss in one or both eyes. People may also present with other things such as vertigo, difficulty walking, balance problems. On top of that, people with MS also have a lot of other invisible symptoms that are present and can really significantly affect their quality of life, such as fatigue, pain, bowel and bladder symptoms, things like depression and anxiety. And so one thing that we need to know about multiple sclerosis is that it's an unpredictable disease. It's unique in every person with MS, and just like a fingerprint, and no two people with MS have the same exact experience.
Okay, so what are the 4 different types of MS?
So, 85% of people present with the most common type of MS. It's called relapsing remitting multiple sclerosis, where people present with attacks or flare-ups of symptoms. We also call them relapses, followed by periods of complete or partial recovery. And this is followed by remissions where people feel better. But if people with relapsing remitting multiple sclerosis are left untreated, they can transition into the second type, which is called secondary progressive multiple sclerosis, where they continue to have progressive decline over time. Another third type of multiple sclerosis is called the primary progressive multiple sclerosis, where they continue to have weakness or other neurological symptoms that progresses over time. People also may have what is known as clinically isolated syndrome, or CIS, where they may experience one attack and then never develop any further attacks over time. Another preclinical MS type is called the radiologically isolated syndrome, or RIS, and that's where people may experience or have basically MRI changes that look like MS without having any symptoms suggestive of MS relapses.
Okay, so are cases of multiple sclerosis rising, or is our awareness increasing?
Yeah, I think that's a very good question. I think it's a little bit of both. The prevalence is certainly rising, but we also know that our understanding of the disease process has improved over the years, as well as our diagnostic capabilities that lead to an earlier diagnosis.
So who's at higher risk for developing MS?
Anyone can be affected, but women are more likely to get multiple sclerosis. People are usually diagnosed in their 20s to 40s, but sometimes there are exceptions, and we see children with multiple sclerosis, or sometimes people may present for the first time when they're 60 or 70 years of age. We don't know yet what causes multiple sclerosis, but we know that there are multiple factors that increase the chances of developing multiple sclerosis, such as genetics, genetic risk factors, viral risk factors, and environmental risk factors like obesity, smoking, as well as vitamin D deficiency. There's a lot of data that shows that low vitamin D levels and people living in areas further from the equator can have a higher prevalence of multiple sclerosis.
Now, why is early detection key in living well with multiple sclerosis?
Early detection leads to better outcomes. Studies show that people with multiple sclerosis who are diagnosed and treated early do much better. We also know that people with relapsing remitting multiple sclerosis, if left untreated, can transition to the secondary progressive form, which is more difficult to treat. MS can be tricky also at times because people may develop symptoms that usually get better, and so they may not seek medical attention because they think that the issue has resolved itself. And so I think people really need to be aware that they need to get evaluated if they ever experience any symptoms, even if they resolved, to prevent any accumulation of disability or worsening symptoms over time. On top of that, the MS diagnosis itself can be complicated. The disease itself is a complex disease and requires an extensive workup to rule out other conditions that rule out multiple sclerosis. Our team at the MS Center is dedicated to multiple sclerosis, and we are here to diagnose early as well as offer the latest treatments available.
Now, the great news for people living with multiple sclerosis is that there's been so many exciting advancements and treatments over the recent years. Can you tell me about some of the latest advances?
Yeah, the landscape for multiple sclerosis treatments has changed a lot over the past few years. In the past, we only had injectables, but now we have more and more treatments becoming available all the time. We have oral pills, we have infusions, and we've got even treatments that can be completed in 2 to 3 years. At our center, we offer our patients the latest medications, and we are also actively participating in the latest clinical trials. Right now, we are actively recruiting patients in 2 clinical trials, actually, looking at a new class of medications called the BTK inhibitors that target inflammation and target those cells that create inflammation and worsening disease over time. Another very exciting and impressive development was a new study that was just published earlier this year by Harvard and their collaborators looking at people from the US military. The study provided the strongest evidence and relationship between a virus, a very common virus called EBV virus that causes infectious mononucleosis, often called the kissing disease, to developing MS later in life. And what's really exciting is that researchers right now are looking at a vaccine to target that virus to prevent multiple sclerosis. There are also other ongoing trials looking at antiviral medications for the treatment of MS. A lot of promising data is also coming out of stem cell therapies. There are other trials looking at remyelinating agents, or agents that basically can repair the damage caused by MS attacks.
Now, what's your final message for people watching today?
I'd like people to know that MS therapy has come a long way. While there's still no cure for multiple sclerosis, effective therapies are available to modify the disease course and improve the quality of life of people living with MS. If you have MS, I encourage you to be a part of the decision-making around your MS management. We are here to help you and guide you and walk with you through your MS journey. And if you ever experience any MS-like symptoms, or even if your friends, neighbors, or loved ones ever have any symptoms that are suggestive of the MS attacks, I encourage you to speak to your provider to get evaluated. Early treatment is key. And right now, there's so much light and hope for people with multiple sclerosis with ongoing research and the newer treatments becoming available all the time.
Well, thank you so much again for joining us.
Thank you for having me, Lindsay.
To learn more about St. Luke's Comprehensive Multiple Sclerosis Center, visit stlukeskc.org/MS Center. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.